What is high blood pressure and what are the risk factors? What is high blood pressure? By conventional medical definition, blood pressure is defined as the force of blood against the arteries when the heart beats, as well as when the heart rests. Blood pressure is generally measured in millimeters of mercury. What are the risk factors? Among the risk factors that heighten the onset of high blood pressure include lifestyle factors such as smoking, obesity, an unhealthy diet, excessive alcohol intake. Also included are high cholesterol level, high triglyceride level, kidney diseases, a family history of high blood pressure, early menopause in women, age, and ethnicity. Why is it important to control blood pressure in diabetics? When a person is diabetic, controlling blood pressure is vital, because high blood pressure is a major risk factor for the incidence of cardiovascular disease. It also heightens the risk for stroke, heart attack, as well as other complications such as nephropathy, or damage to the blood vessels and kidneys, and retinopathy, or damage to the blood vessels of the retina. When a person has diabetes and high blood pressure, the person's risk of developing cardiovascular diseases also doubles. What causes high blood pressure? The pressure in the blood vessels is dependent on how hard the heart pumps and beats, as well as on how much resistance is felt in the arteries. Many physicians contend that a slight narrowing of the arteries heightens the resistance to blood flow, and thus increasing blood pressure levels. However, many physicians agree that the cause for the narrowing of the arteries is still unclear, and many factors may contribute to it. The perks of lowering blood pressure. A great deal of concrete evidence is available, which shows that controlling blood pressure levels in diabetics greatly helps in reducing the risks of future complications, such as stroke and other associated problems. A British study called the UC Prospective Diabetic Study confirms that people with diabetes who controlled blood pressure stood a third less risk of dying from heart attack or stroke, as compared to those who failed in controlling blood pressure levels. The study also indicates that effectively controlling blood pressure offers a number of benefits, as compared to simply controlling blood sugar levels, and practically reduces the risk of getting other diabetes-related complications as well. How can you lower blood pressure? There's actually no cure for high blood pressure. However, it can be controlled. Blood pressure can be effectively lowered in two ways. First, by implementing lifestyle modifications, such as having a good diet, lowering weight, regular exercise, lowering salt and alcohol intake, and all these do a great deal in lowering blood pressure levels. Second, several medications are also available for lowering blood pressure. However, the drug chosen will depend on such factors like age, ethnicity, possible side effects, and if you take other medications. In some individuals, the blood pressure medication is needed for life. However, for those who have their BP controlled for some period of time, the drug may be stopped or reduced. Having a healthy diet in individuals who have effectively reduced weight, stopped heavy drinking or smoking, and perform regular exercise, their doctor may advise that they reduce their medications. Having a healthy diet can truly help as well. It can effectively lower bad cholesterol, control weight, provide your body with fiber, vitamins and nutrients, and strengthen your immune system as well. How would you know if you have high blood pressure? Many wrongly believe that high blood pressure has got something to do with being nervous, hyperactive or jittery. However, the truth is that even when you're calm and relaxed, you can still have high blood pressure. Even if your blood pressure is repeatedly high, you sometimes won't see or feel the symptoms. It is true that a number of people have had the disease for years, without knowing it. Well, the only way to find out if you got high blood pressure is to have your BP checked. A blood pressure test is easy and painless, and it can be done in the hospital clinic, doctor's clinic, nurse's office or company clinic, as well as at your nearest public health care facility.